Well, good afternoon, everybody. My name is Christoph Stremikis, and I'm the Director of the Market Analysis and Insight Program at the California Healthcare Foundation. CHCF is an independent, not-profit foundation dedicated to advancing meaningful, measurable improvement in the healthcare delivery system here in California. We're particularly focused on improving outcomes for those with low incomes and other Californians who are not well served by the status quo. Today is an exciting day for the Foundation as we begin to release results from our signature Regional Market Report series. As you see on this slide, our regional market reports are in-depth studies of 7 diverse areas that reflect a range of economic, demographic, care delivery, and financing conditions here in California. You can find the first report, which is focused on Humboldt and Del Norte counties, and which we're going to be discussing here today, on our website at chcf.org. We'll continue to release these reports and conduct webinars like this through the rest of the year and into early 2021. Our regional market reports are based on original data and hundreds of interviews conducted by the consulting team you see listed here in the last bullet. And we're so fortunate today to have the lead author of the first report, Jill Yegian, here to briefly highlight her findings. You'll see on the next slide that she's joined by a pretty impressive group of local healthcare leaders that you see on your screen. Each is here to talk about the unique challenges and opportunities that they're seeing in their own communities in the northwest corner of our state. 2 very brief housekeeping items before I turn things over to Jill. First, please do take advantage of our panel's expertise by entering questions into your Q&A box at any time during the next hour. We'll be monitoring these questions and we'll squeeze in as many as we can after everyone has spoken. Second, please do take a minute when the webinar concludes to fill out the evaluation that's going to pop up on your screen. I can tell you your feedback is really valued. We really will read it very closely and it helps us with future programming. With that, I'm going to get out of the way. Let's get started. It's a pleasure to turn things over to Jill Yegian, principal at Yegian Health Insights, affiliate at Blue Sky Consulting, and lead author of the first regional market report on Humboldt and Del Norte counties. Jill, can you go ahead and unmute yourself, turn on your camera, and kick things off for us?
Thank you, Christoph. I am so pleased to be here. Next slide. So before diving into the findings, I wanted to spend a minute on the big picture of the approach to this and the other regional reports. You can see on the map that on the right of the slide that they are displayed across the state with Humboldt and Del Norte at the far north. This is the first time that Humboldt and Del Norte or anywhere in the rural north has been included in the regional market study, and it was really a privilege to take the lead on this report. There are 3 main sources of information that we have pulled in to create these reports. The first, and it's really the signature component of this effort, is lots of interviews with the local leaders on the ground. So this includes health plans, providers, both on the public and private side, the county government, and other community leaders. It is important to think about the quantitative data as well, and that's the second source of information. So OSHPD's hospital utilization data, CHIS, census, many different quantitative data sources were used in the report as well. And the third source is local market news. It's been a big news year, and so we paid a lot of attention to what's unfolding on the ground and to the local implications of state and federal policy changes as well. All of you know that COVID has really changed the healthcare landscape this year. And while this study started before the pandemic began, it clearly needed to be taken into account. So we've really tried to balance making sure that COVID is incorporated into this report and all the reports, while acknowledging that this is not a study of COVID. And then finally, I wanted to really acknowledge my co-author, Katrina Connolly, and the whole Blue Sky Consulting Group team. Next slide. So let's start with an overview of the demographics and the area. Humboldt and Del Norte are spectacular counties. Beautiful coastal area with large swaths of redwood forest. They're also small, about 28,000 people in Del Norte and about 136,000 in Humboldt. And the area as a whole has struggled to diverse economically after the decline of the logging industry. The graphics that you see on the left of the slide come from the quick reference guide that was issued along with the report. And you can see from the pie charts in the upper left that there is a pretty big distinction between the makeup, racial and ethnically, in Humboldt and Del Norte compared to the state as a whole. So about twice the proportion of the population is white, and about 6% is Native American. So that shows up in the 10% other. Another key distinction is that much larger proportion of the area residents are poorer. So we see about 20% of the population lives in a household with income below 100% of the federal poverty level, compared to about 13% statewide. It's a slower growing population, hovering around 1% over the last 5 years, compared to above 3% statewide. And the population is much more likely to obtain coverage through Medi-Cal and Medicare than through private and other sources, which you can see on the pie charts on the lower left. Next slide. So this was a stunning slide for us on the research slide. Last slide, please. There we go. The death rate in Humboldt County is about a third higher for all causes than it is statewide in California. We looked at a lot of data for this report, but this was really quite sobering and stunning for us. When you look at the condition-specific causes of death, you can see that for stroke, it's about twice as high in Humboldt as it is compared to the state as a whole. For suicide, about 2.5 times. For firearm-related deaths, about 3 times. So these are really substantial differences in terms of the death rate. I do want to mention that the numbers look similar in terms of their direction and pattern in Del Norte, but they are statistically unreliable and so not included in this table, which comes from the report. What we see here in terms of this differential is consistent with what's emerging at a national level in terms of what's becoming termed structural urbanism. And essentially that is defined as a systematic bias toward large population centers and against rural areas. In spite of these challenges, it was really inspiring for us in these interviews to hear the local community leaders express things like there's hope and innovation in our community, and we need to figure it out working together. So a tremendous amount of collaboration. Next slide. I'm going to paint just a high-level sketch of the market, and of course we have experts on the panel who can drill down. From the health plan side, Partnership Health Plan is the county organized health system in the area on the Medi-Cal side. So responsible for Medi-Cal in both Humboldt and Del Norte, as well as a number of other rural North and other counties. Partnership has a strong local presence and is very active in the area, which is not the case for the commercial plans. Anthem and Blue Shield are both offering the private coverage in the area, but neither one has much of a local presence. On the hospital side, there are 5 hospitals in Humboldt and Del Norte, 4 in Humboldt and 1 in Del Norte. This table presents a comparative assessment of those hospitals and is available in the report. I'm not going to go through it in detail here. I'll just note that St. Joseph is the dominant player in the area with the largest size at 138 beds and the most advanced services provided. On the primary and specialty care side, what we heard consistently from interviewees is that independent practice has essentially largely disappeared. And this has really affected the role of the Humboldt IPA in the area, which has become much more community-oriented as the role that it plays in contracting for health services has declined somewhat. What we see as well as a consequence is Open Door Community Health Center taking on a much broader role in providing primary care from just Medi-Cal and uninsured patients to a much broader swath of the community. And we see something similar with St. Joseph Medical Group taking on that same role, but on the specialty side. So physicians who didn't retire or move away have moved largely to Open Door or to St. Joseph Medical Group. The other main provider in the area is United Indian Health Services, which provides care for 9 of the 11 tribes in the area, and the other 2 tribes provide their own services, the Hupa and the Karuk tribes. And then, of course, the county plays a major role, particularly when it comes to behavioral health services. Next slide. One of the key findings of the report was what one respondent termed as an extreme challenge with access. And so what we see is as physicians and other clinicians have retired or relocated, the 2 counties have struggled to recruit, in part due to how remote the area is. And as a result, there's a shortage of health professionals. And we can see in the table on the right for physicians that the numbers in Humboldt and Del Norte are substantially lower than they are in California as a whole, and than is recommended in terms of the supply. So for example, on the primary care side, there are about 40 physicians per 100,000 population compared to 60 in California, which is the lower end of the recommended supply. And the pattern looks similar on the specialist side. As a result, we've seen a strong collaborative community response, which we heard called Grow Your Own. That is includes a new and very exciting family medicine residency program that's a collaboration between St. Joseph Hospital and Open Door Community Health Center. Open Door also has a family nurse practitioner residency program that's been around for about 4 years. And there are programs at Humboldt State and at the local community college to provide a career pathway for local residents. Now, schools have also created pathways so that students can go on to college or vocational work in the area. And collectively, what these initiatives are doing is to attempt to simultaneously address the access to care shortage in the area and diversify the economy by creating career opportunities in health. Next slide. Another key finding is the extent of innovative data sharing in Humboldt to support care coordination. The North Coast Health Improvement and Information Network, or NCHIN, was created about a decade ago. And you can see from the graphic on the right that interfaces have been built to all of the local providers in the area, or most of the local providers in the area, as well as to state reporting systems, to partnership health plan, to the county Health and Human Services Department. So this is a well-used health information exchange in the area. And so, for example, when a patient registers at the emergency department, that will trigger delivery of a real-time medical summary that includes diagnoses and is available to the clinician treating the patient in the emergency department. On top of the HIE, NCHIN has worked to create a care coordination platform and has worked with Activate Care to create additional interfaces beyond healthcare to housing and to other programs from law enforcement and probation. This program serves about 1,400, 1,400 clients who have complex needs, and it's used by the Humboldt County Department of Health and Human Services for their outpatient mental health case management program, as well as for a number of housing programs that have been created. It's also used extensively by St. Joseph for an array of community benefit programs. Next. So COVID, data is available through August at the time of the report writing. And so you can see from the two rightmost columns in the table, the Humboldt and Del Norte region compared to California statewide, that Humboldt and Del Norte had a much lower case rate and death rate from COVID compared to California, over 10 times as high for California deaths as for Humboldt and Del Norte. On the unemployment side, the Humboldt and Del Norte numbers approximately doubled in terms of unemployment, which is obviously not desirable, but lower than the state, which was closer to 3 times. The expected increase in Medi-Cal enrollment did not materialize. There was an expectation that the recession associated with the pandemic and the job loss would cause an increase in Medi-Cal enrollment. And as of August, that was not seen in the data for Humboldt and Del Norte. When we talked, again, our interviews occurred between March and May, so the early side of the pandemic. And what we heard about was 2 main things. One was a rapid pivot to telehealth, and the second was extensive preparations for a surge, which fortunately did not materialize. On the county side, that care coordination platform that I mentioned was pressed into service for caring for, treating, and coordinating the care of COVID positive individuals in the county. And the county is struggling, as are counties across California and the US, with the sort of double hit of increased costs associated with public health and medical needs for preparing and dealing with the pandemic, and at the same time that revenue for the county falls in the recession. Next. And finally, in terms of issues to track, I know certainly I will be following closely progress in Humboldt and Del Norte on some of the key issues, including how well the workforce initiatives do in addressing the shortages and the related access to care issues, what will happen with the community efforts at health information exchange and whether that is successfully broadened into community-based organizations and the social services sectors, what will happen with telehealth services as the pandemic continues, and eventually we all hope we are past it. And then, of course, what the economic consequences will be as COVID-19 plays out for the providers, for the county, and certainly for the patients. So with that, I'll turn it back over to you, Christoph.
Thank you, Jill. That was a lot of great information, and I can tell everyone there's a lot more great information that Jill and the team collected and put into the brief, which is now on the website. But at this time, I'm really excited to turn things over to our panel of local healthcare leaders for their perspective on some of these challenges and opportunities in the community that Jill just touched on. Each panelist will provide 3 or 4 minutes of remarks on any findings that were particularly surprising, anything that really resonated, or anything else that they'd like to highlight. Before we do that, as a reminder to our audience, please feel free to type in any questions for our panelists into the chat box. We'll moderate those in a brief Q&A after everyone has had a chance to provide their initial thoughts. So at this time, I'd like to turn things over to our first panelist, Rosemary Den Uden, CEO of Humboldt IPA. Rosemary, can you unmute yourself? I see you have your camera on, and let us know, how do things look in Humboldt and Del Norte from your perspective?
Well, thanks, Christoph. And first of all, thank you, Jill and Katrina, for this report. It's just fantastic to see that it's really confirming what we've known for quite some time. In fact, we are sicker and older up here in the northern region. And it really just points to the innovation and the resourcefulness that we've had to have over many, many years. I work with the Humboldt IPA, the Independent Practice Association, and as the report highlighted, independent providers are all but gone. But, you know, leaning in to our partners and really finding creative resources amongst our community has been how we've addressed many of these issues. I think the report, it points to ACEs and being a contributor of some of our poorest health outcomes, but it really underscores that, you know, the importance of having to focus on ACEs. And as you saw in, what we're dying from most, which are all contributed to by the adverse childhood experiences. So really just highlights again how the importance of focusing in on early childhood trauma and where that can really turn the tide for a lot of these issues that we are facing. Humboldt and Del Norte counties, it's some of the most beautiful environment in all of California, and yet we have a lot of struggles that some we've resolved and others we have not. And the partners, some of which that are on this call today, have really worked hard to find those solutions. I think COVID, like for so many of us, has really caused all of us to pause on the work that we've been doing, especially around substance use disorder. COVID has taken us a little bit offline, but it hasn't gone away. So just really, as we look forward, thinking about how to focus simultaneously on the things that we have to have in place to protect our residents against COVID, but also, knowing that so many of our residents are suffering from substance use disorder and, overdose deaths. And it's really important for us to stay the course and to remain focused on that. This report really comes at a great time as we get ready to close out this year. I think it shows us we've done a lot, and yet we have a lot more to do. So I thank Jill and Blue Sky Consulting and CHCF for this report and really highlighting some of our successes and our opportunities.
Thank you for that, Rosemary. That was perfect. I want to move us along. It's my great pleasure next to introduce Liz Gibney. Liz is the CEO of Partnership Health Plan. Liz, can you unmute yourself? I see you have your camera on. How do things look to you up in Humboldt and Del Norte?
Well, thanks, Christoph. It's great to be with all of you this afternoon after quite a long week last week. I wanted to just highlight a few things that I saw in particular in the report. And first, since there's so much conversation right now about the impacts of the Affordable Care Act and its impact locally, I just wanted to provide a couple of numbers and data points specifically for Humboldt and Del Norte counties and the impact of the ACA locally, just on the Medi-Cal enrollment as an example. About 20,000 folks in Humboldt County and over 3,000 folks in Del Norte County are on Medi-Cal because of the flexibilities and the permissions the Affordable Care Act gave to California and that California took advantage of. So those are just some local data points for all of us to keep in mind as the Supreme Court looks at the Affordable Care Act in just a few days. Like Rosemary, I also wanted to highlight the behavioral health impacts. Partnership is very proud to have launched a wellness and recovery drug treatment program over the summer just in Humboldt County. And we're seeing certainly tremendous need for substance use delivery, substance use disorder services. But we also know that COVID has had a tremendous impact on folks' ability to go to get treatment. And in particular, in residential treatment settings, the impact of the pandemic is very striking, given that understandably folks are hesitant to be in a congregate living environment. So we are hopeful and want to continue to urge telehealth as a way to bridge that gap until the pandemic is over, and then certainly beyond, looking at continued telehealth flexibilities as a key to opening up access and engaging folks in treatment as early as possible and sustaining them, especially in more rural areas. So we are hopeful about that and certainly want to continue to advocate for that. And then the last thing I want to touch on is workforce and the tremendous strides that have been made, but still many, many challenges. Along with our partners, we've been able to fund almost 80 different physicians and nurses coming into the area and beginning their practices or continuing their practices. But we also know that many, many other providers have left the area or have retired. And this is a challenge we see up and down California. But we want to continue to promote those opportunities and bring folks to this extraordinarily beautiful area of California. One thing we are watching, and it also relates to behavioral health, is new legislation that was just passed this year on peer support specialists and being able to find a reimbursement pathway for folks who have lived experience and encouraging them join the healthcare workforce and make a real difference in providing a job opportunity for a local resident, but also in helping folks get into recovery going forward. So I'm more than happy to answer questions during the next segment, and thank you all so much for this report.
Liz, that was great. Thank you so much. Next, we're privileged to have Roberta Luskin-Hawk from St. Joseph's Health here to share her perspective. Roberta, I see you have your camera on. Can you unmute yourself and take things away?
Yes, absolutely. All set. Anyway, thanks for having me here, Christoph. Certainly with St. Joseph Health as part of Providence, we have not only our local resources, but we're very fortunate to have access to some additional resources that where we can leverage the wonderful partnerships I found when I came to Humboldt County. I was really struck by the collaboration and the platform that was here, and really the willingness of people to work effectively together. So while as the two hospitals, we deliver a lot of inpatient care, we have extraordinary specialty care, things you might not expect to see here, an advanced cancer center with stereotactic radiosurgery, where we've got a cath lab that's open 24/7, some really talented folks, but not enough of them, always recruiting. And it's really been a pleasure to be part of the family medicine residency. And we fully expect that today there are 12 residents, there will be 18 by next summer. And we expect a significant number of them to have some interest in staying. And so the collaboration started well before I came, but good work in that the direction of really supporting the needs. We've also, through Providence, had some unique funding opportunities, helping through Wellbeing Trust to fund the detox center, and also some of the substance use disorder collaboration across organizations in the county have been helpful. And most recently, we're actually, through Providence Supportive Housing, developing housing for those who are chronically homeless. We have a philosophy that many of you share, I'm sure, that housing is health. And so a strong interest in trying to get people into stable, safe housing so that they can start addressing some of the other issues, whether they be mental health, substance use disorder, or other social determinants. So there's, my job, I think, is to identify where either we locally can have impact on the gaps, or where I can leverage some system-wide resources or money that we put aside for care for the poor to be a force multiplier with some really smart people that we sit around the table with, and whether it's supporting the nursing program at HSU or other projects, that's part of it. I think what's interesting is, in terms of our COVID response, I think what's surprising in some way is, with a lot of preparation, and I still think we're starting to see it ramp up a little. I don't think we're done, but we have enough sophistication that we were able to bring in clinical trials and other things you might not expect in this remote rural area. So we're such a contrast in some extraordinary capabilities throughout Humboldt, with some people who are so innovative and willing to collaborate, and then some startling challenges in terms of both poverty and access to primary care. But it's inspiring and challenging at the same time.
Wonderful. Thank you, Roberta. Next up, we'll hear from Tim Ryan. Tim is the Executive Director of North Coast Clinics Network. Tim, thank you so much for agreeing to participate and being here on relatively short notice. I see you have your camera on. Can you unmute yourself and provide us with a few brief thoughts?
Yeah, you bet. Thank you, Christoph. I appreciate the opportunity. Good afternoon, everybody. As Christoph mentioned, I'm the Executive Director of the North Coast Clinics Network, which is the consortium of federally qualified health centers. There's approximately 14 locations in a tri-county region of Humboldt, Del Norte, and Trinity. And each year we see around 70,000 unique individuals, which roughly translate to around 280,000 visits of either primary care, dental, and behavioral health. One unique statistic that differentiates our consortium from some of the others in the state is the unique payer mix that you would see with a rural community. Our payer mix is roughly 55% Medicaid 25% private insured, 15% Medicare, and then 5% uninsured. And as Liz mentioned earlier, what we saw with the ACA expansion of Medicaid was a tremendous decrease in uninsured individuals. When I joined the network roughly 17 years ago, we were hovering at about 20% uninsured. With that ACA expansion, now we're down to, as I mentioned, to roughly a 5%. The challenge is that of the 20,000 individuals who are on this Medicaid expansion population that Liz just brought up, 17,000 of those actually get their care at one of the primary care clinics in the federally qualified health center at the network. So both reimbursement challenges and or coverage for patients. Another item that, as folks had mentioned with the COVID transition from primary care to virtual care, and how quickly we all as providers in the delivery system needed to be able to respond, both to make sure that the access was there and available, but also the training and education for the providers and the patients themselves. Pleased, now I can report that roughly 50% of visits are happening virtually and 50% in person, which has been extremely helpful. Therefore, at the network, now we're starting to advocate, okay, how do we make this permanent translation last after the public declaration is decreased? And then lastly, I think one of the items that came out was the 340B program. During the report, you can read about the transition of California. The state was going to move the Medicaid 340B back down to Sacramento, away from Partnership Health Plan and out of the local control. And this was of concern, several $1 million to be lost. But what we've seen recently over the summer transition is actually the federal level, and the 340B program and the federal level, also with Big Pharma coming down and starting to clamp down. This is going to be major changes, and I assume is going to impact the work that we're looking at going forward, because these resources are so helpful for a lot of the programs and the collaboration that we're doing as a community. Still a lot of optimism, as everybody has since mentioned. We've got a great partnership. Part of living in a rural area is we don't have as much competition amongst partners, so there is a freedom of information, but there's more work than all of us can carry or lift. So at this point in time, we've got a great group. I'm optimistic that we can at least address the challenges. And again, pleased to be on the phone. Thank you, Christoph.
Thank you, Tim. That was really a great information. Just as a reminder, before we get to our last panelist, I want to remind our audience, if you have any questions for the panelists, please feel free to type them into the Q&A box. And now I'm pleased to introduce Nancy Stark, Legislative and Policy Manager at the Humboldt County Department of Health and Human Services. Nancy, I see you have your camera on. Can you unmute yourself and take things away?
Sure. Thank you so much. And thanks to the California Healthcare Foundation, and especially Jill for this terrific market study. We don't often get a lot of attention up here on the North Coast. So thanks for taking the time. I guess that the number one thing that I hope comes through to readers of the report is just how collaborative and interdependent our systems are. We just don't work in silos here. We can't afford to. Every one of the local initiatives that's mentioned in the report, from the Grow Our Own Healthcare Workforce to expanded substance use disorder treatment or cross-sector data exchange, they all relied on our multiple systems coming together to solve a problem. It's true that we survive and thrive together on the North Coast, and I would say that our relatively low COVID rates and continued yellow tier status in our county are reflective of that. I also like to say that we are scrappy and we are perseverant here on the North Coast. The drug Medi-Cal organized delivery system took more than 5 years to design and to launch, and is just a great example of our system's collaboration and interdependence. That couldn't have happened, and the county couldn't have expanded substance use treatment disorder services without each one of the organizations that's represented on this panel and many more. It took all of our services working together to make that happen, and we persevered and launched in July. I think probably what's most interesting or compelling to me in the report is the cross-sector data exchange, just because it has such potential for increasing efficiencies, for addressing social determinants of health, our high ACEs prevalence in our communities, and ultimately just reducing the total cost of care. I would say that embedding specialty mental health data into the local health information exchange and then launching the Activate Care software has just been a game changer in terms of cross-system collaboration and efficiency. Our county homeless street outreach workers can get real-time ADT information from our local hospitals, the psychiatric hospital, the jail. Can get all of that information in real time in the palm of their hands. They can coordinate with the discharge planners at the hospital right on an app. They don't even need a laptop. So it's just reduced confusion and redundancies, and it's just better, more efficient care. And I would say that the county is really excited about the next step in that evolution, and that's implementing a much broader community information exchange. A CIE with closed loop referral and human-centered design. It just, again, gets us all closer to our common goals of better service, better outcomes, increased efficiency, and lower cost of care. Yes, we do a lot with few resources in small rural places with a whole lot of collaboration. So I'm hoping that that's what people take away from the report. Thanks so much for having me today, and thanks for the well-written report.
Well, thank you, Nancy. Great job, and great job with everything you're doing up there. At this point, we miraculously are right on time, and I'd like to use that remaining time for a general Q&A with the entire panel. So I'd ask everyone on our panel to please turn their camera on and unmute themselves. And as a reminder to the audience, please feel free as we move through this to put any questions you have for the panelists into the Q&A box, and we'll do our best to get to it. To kick us off, Lisa, have there been any questions that have come in so far?
Yes, Sierra Braggs asked a question about telehealth, and it's specifically to partnership. Will partnership offer funds to purchase devices and or internet so that people with low incomes can access telehealth?
Thanks, Lisa. That's a great question. Liz, I'd love for you to take a crack at that one. And then after that, Tim, I know you mentioned telehealth too. I'd love to hear a little more from the clinic perspective, what you think some of those remaining needs are for both providers and patients.
So just to quickly address that, partnerships efforts right now have really been focused on ensuring that our providers are fully able to utilize all the telehealth flexibilities. So we've been rolling out grants that support our primary care providers, doing a greater and greater share of their virtual visits as video visits, with the hope that once COVID is over, and the flexibilities will remain, and that those visits will count for the FQHCs. We have not done grants or provided telehealth equipment directly to members, other than a small pilot we're running on some remote monitoring equipment that we hope to expand. We're just started that a few weeks ago. And we are also tracking all the broadband activities that are going on statewide that COVID has brought to the forefront. It's a great question.
Thanks, Liz. Yeah, Tim, do you have some thoughts on that from the clinic's perspective?
Sure. There's this brick and mortar piece, this technology piece. We need the high-speed internet. We need the equipment to be able to utilize the tool. And then the reimbursement, obviously, that follows that. And during this public health declaration, the reimbursement is allowed. And so part of what the transition for us in the primary care setting is, how do we start to educate providers? How do we get consistency across the entire delivery system? And then once we flip to the patient side, how do we make it accessible and easy enough for patients that they'll actually utilize it? As I briefly mentioned, we're up to 50% utilization of virtual care visits now. Again, all utilization for all types of delivery was dramatically reduced when COVID hit. But that ability to have one more tool that we can use to bring access to folks, something that was surprising and somewhat startling, I automatically assumed that our senior population was going to be one of the more challenging folks to try and get on board. What we found is that several folks love not having the logistical challenges of trying to get to a provider office, to have to do their hair, to get the makeup going, to get the food, get it, that they can hit one button and connect. And it was kind of, our assumption was it was going to be the younger generation and a forced effort. So we've been pleasantly surprised. I will end that I think it's culturally, the organization itself needs to endorse using these technologies. And it needs to go from the provider champions all the way through the C-suite, all the way down to the individual patient, because any sort of variation in that, it's a slow uptick on the adoption of it. Thank you.
Yeah, thanks very much to both of you. I know we do have a number of questions, so I'm gonna move us along in the interest of trying to get to as many as possible. Lisa, do we have another one queued up?
Yes, it's from Mitch Hanna. What is the chance that the Community Information Exchange might be expanded to Del Norte County?
Well, that's a great question, and I think Nancy, you touched on that briefly in your remarks. So I would love to hear your thoughts on that. And Rosemary, I'd like to bring you in after Nancy if you have some thoughts.
I believe I'm going to pass this off to Rosemary. I believe that that our local HIE does serve some providers in Del Norte County. Rosemary?
That is correct. The open door providers that are based out of in Del Norte are certainly a part of the information exchange. And we certainly want to expand that to our surrounding communities. However, it does become more complex, and the issues that arise around adding more and more providers to the health information exchange just gets more enormous as we bring on more communities. But as we look at a regional approach and how to best serve the members that are in our region, we recognize that it is important to bring those providers into the HIE. And when we talk about the community information exchange, we're already starting to engage our partners in Del Norte and Curry counties, in fact, as we build out a resource directory that's a part of the Enshin health information exchange, book of business, if you will. So yes, the answer is yes, but it's going to be a long haul that we hope to get to eventually.
Thank you, Rosemary. I know we've got a lot of questions coming in now. Lisa, is there another one queued up for us?
Yes, this one is from someone who did not wish to share their name. It says, could you please provide explicit info on best pathways to connect people to peer support specialist positions for those with lived experience?
Yeah, that's a great question. Roberta, I hate to put you on the spot, but I know you mentioned peer support around some of the SUD and homeless supports. Do you want to take that one?
Yeah, I think it's we're at the cusp of doing more. Certainly, a number of any population health foundation recognizes that community workers and peer support often bring a deeper understanding and a better connection to help guide people through making decisions. In our organization, so at St. Joseph Health, there's a group called Care Transitions, and actually we're looking over the next year at potentially expanding that. That potentially could open up opportunity for people with lived experience to help in these roles and get training. I think recently we filled a position for the substance use disorder program, but others on the group may actually know if there's any specific open positions. But I guess I'd look at the IPA, I'd look at our website in terms of St. Joseph Health Northern California. As things evolve, there will be more opportunity. I think we all agree that there's special connections and impact that people can have when they've have the lived experience.
Thank you so much, Roberta. Lisa, do we have or Nancy, did you want to jump in?
I would say that both Humboldt and Del Norte County Health and Human Services, we both employ a pretty good number of peer support specialists across our mental health, substance use disorder, our transition age youth division also employs peer support specialists. And it seems that we're constantly recruiting and training and hiring. And I believe that's true for Del Norte County too. So that's one opportunity should someone want to pursue that profession.
Thank you so much, Nancy. Lisa, do we have another question?
Yes, this one is also from someone who's anonymous. Can you please expand on your evaluation methods? And asks if there's a methodology in this report.
Hey, that is perfect because I know who that's going to. Jill, do you have some thoughts on, or can you share some data on your methods?
I actually really think Tim should field this one. How about it, Tim? Sorry, just kidding. The report has extensive notes associated with all of the tables that describe the data sources in detail and almost universally provide links that should take the reader to where the data comes from. There are also extensive endnotes provided to back up the assertions that are made in the report. It is worth noting that much of what makes the report, I think, valuable and rich is the interview findings. And you will not find documentation of those. Part of what makes the project so valuable is that we guarantee confidentiality to all of the interview subjects. No one is quoted. There is no list of interviewees. And so people are free to tell us more candidly than they might otherwise exactly what's going on. And that's really valuable. So we do an extensive number of interviews for Humboldt and Del Norte. It's a smaller area than, for example, Los Angeles. So it's about 18 interviews in Humboldt and Del Norte, about 30 in Los Angeles, and varying numbers depending on the size of the region. But in no case will there be a list of interviewees. But there is an extensive amount of documentation of the data sources from a quantitative perspective, and all of the quotes are identified as being from one or more respondents, and the endnotes provide a lot of documentation of what I was talking about related to the news and other sources of information that were pulled in. I'd certainly be happy to answer additional questions offline.
Thanks so much, Jill. There is a lot of information that you've synthesized really nicely and footnoted and documented, and I can say it is all in the report. I might exercise moderator's prerogative here for just a second because I've got my own burning question, but I do, in the 5 or 6 minutes we have left here, would remind the audience, please get your questions in the Q&A box. This question is maybe for Tim and Liz first, though everyone else is welcome to jump in. Tim, you mentioned the 340B program and how important that is to a lot of your members. And I know we're in for some big changes to the prescription drug benefit in Medi-Cal at the beginning of the year. So maybe, Tim, can you talk a little bit about what sort of impact you see this carve out having on the population that your members are serving? And Liz, I would direct the same question to you then.
Sure. And so I'll let Liz speak to the patient side of it. Obviously, it's going to be significant for the impacts of what they've currently been on as far as the regimen and the formulas and their prescriptions. What it means, at least from our side, is that the programs and the support that the 340B program is able to subsidize are the nutrition programs, the diabetes educators, the outreach and enrollment. So much of the community strides we've made that are non-reimbursable services that we all collectively put together are at stake, just because those funds are what help complement the whole healthcare delivery, not just the primary care itself. So from my standpoint, I think as a community, and especially as a small rural community, we're going to have some pretty tough times ahead of us trying to backfill the services that are currently being supported by the 340B program. You mentioned specifically the state side, and yes, the transition's happening January 1st. It's going to be extremely significant. The legislature tried to put some money back in to backfill that. The governor's budget came out, things were rough. That money got pulled back out. So I see kind of this teeter-totter happening on the state level. I alluded to the federal changes in big pharma. Those are also concerning because it's across all payers, and that's going to be obviously a national program. So I think the impact of what the program and services that are currently being subsidized by the program are what we're going to see as individual users or consumers. Liz?
No, I think that's a great assessment. The only thing I would add, and it's certainly not to be underestimated, is the impact to the members in this transition period. They will have not just one, but two now systems of care to navigate. And it's going to be confusing, at least initially, about which path they choose. So we're putting in more and more time on member education about the transition, certainly provider education, since the providers will also have to learn and navigate two different systems. So we expect it to be complicated. One of the things we're most concerned about is our folks at the partnership having access to real-time data about the services being delivered in the other system of care, so that we can continue to provide case management to our members that appropriately and accurately reflects the medications that they're on. And with a slowdown in that data or an incomplete picture, it makes our job and our providers' jobs very difficult.
Yeah, thank you for sharing that, Liz. I did, as we're kind of running out of time here, I did want to circle back just on workforce, because it did certainly, it's something that Jill highlighted, and I heard it in a number of the comments among you. Roberta, you had mentioned the family medicine residency program that St. Joe's is deeply involved in now. If we were going to do this regional market report up in Humboldt and Del Norte in 3 or 4 years, what do you hope we're going to find? What are the realistic expectations around some of these workforce initiatives, and how much better are things going to be in 3 or 4 years?
Fair questions. I think that the data is that about 40 to 50% of residents tend to end up working within 50 miles of where they train. And as we're looking at residents, we're looking for people who have kind of an appetite for rural medicine. We're also part of something called Compadre with OHSU and UC Davis, where we can bring medical students who are interested in rural medicine in to the community to get clinical experience and move on. So I'm assuming that 5 years from now and 8 years from now, you'll start seeing more locally trained primary care physicians. But we also, we've got we've got the RN to BSN program. We historically have educated pharmacy residents, physical therapy students, PAs, nurse practitioners, but there's room to do more. And so we're having conversations with College of the Redwoods about, could we develop an imaging tech program? We're talking to HSU about clinical laboratory scientists. They're graduating kids with degrees in biology and chemistry, and with a little bit more, there could be an amazing, well-paid career path, and something that we need both locally and throughout California and throughout the country. So I think building on the infrastructure we've started, we should be able to add some additional training programs and really create this rural healthcare education center.
Thanks so much, Roberta. Rosemary and Nancy, I want to bring you in before we end here. Maybe same type of question to you. Rosemary, when you look ahead, you mentioned some of the work around ACEs and some of the SUD programs, or some of the data programs. In 3 or 4 years, if we were to do the Humboldt and Del Norte study again, what would be the big success here, or successes?
Well, going off of Dr. Luskin-Hawk's comments around the residency program, we've also done extensive work within the K-12 schools to really build their science education and their other curriculums to showcase all the available jobs within healthcare and social care and behavioral health. So, my hope is that kids that are going through K-12 right now will be exposed to many, many more available careers other than, physician, nurse, the traditional ones. So I'm hoping that in 3 to 4 years, we have a much greater appetite for our kids to join the healthcare workforce, from kitchen to lab scientists to janitorial to, beyond, because we need all of those jobs. Additionally, I think if we are continuing in this COVID era, we really need to address, the lack of broadband accessibility in our region. We do some work within the schools, and what we're finding is that parents are really struggling having enough connectivity. You've got your kids doing Zoom, everybody else is doing Zoom, and then, trying to have your doctor's appointment via telemedicine. That's becoming really challenging for, these working families and, others to afford, the cost of internet connectivity. So I'm hopeful that we can solve that problem within our region and make sure that in the era of COVID and distance learning and telemedicine, that we have the resources to support people for that connectivity.
Thanks so much, Rosemary. Nancy, you got the last word.
I hear, Rosemary. I wholeheartedly agree. I was going to say, I'd rather you come back in 10 years and see if any of the fifth graders that we're introducing to health careers right now choose to stay in our rural communities. Thank you.
Thank you so much, Nancy. Well, unfortunately, our time is up. I could talk to you guys all afternoon. I really appreciate it. A couple things before we wrap. First, Jill's excellent slides, her report, a recording of this webinar is all going to be available on our website soon at chcf.org. Second, please join us for the next Regional Market Report Series webinar, which will focus on Riverside and San Bernardino counties in early December. Registration information for that, I'm sure, will be on our website shortly. And finally, please do take a minute to fill out the evaluation that's going to pop up on your screen. As I mentioned, we do look at those closely. With that, I'd like to thank our panelists. I'd like to thank Karen, Scott, and the whole team at Golden State Health Policy for keeping us organized in the run-up to this and really pulling off a technological feat behind this webinar. And thanks to everyone in the audience for joining us today. I hope we were able to get to as many of your questions as we could, and they were all excellent. This was a great event. This was a wonderful panel. I certainly learned a lot about the healthcare system in Humboldt and Del Norte counties, and I hope you did too. Thank you, everyone. Thank you to our panelists for being here. Have a great day, and we'll see you next time. Bye-bye.